2, 3, ready. Hi, my name is Christian. I'll be your student nurse today. And I'll be performing a shift assessment on you today.
Right.
Can you state your name and date of birth for me, please?
Samantha Olivio, 041103.
Okay. Can I take a look at your wristband here? Okay. Patient is female, appears to be 16 years of age and in no acute distress. Patient's skin appears to be pink with even tone, and no obvious physical deformities. Patient appears to be calm, cooperative, and pleasant with appropriate facial expression. Patient appears to be well nourished with good hygiene, well groomed, and no odors. Patient's posture is erect, stature is small, and patient appears to have the appears to be dressed appropriately, and patient's speech is clear and coherent. So can you tell me, Samantha, where are we today?
The hospital.
Okay, and what year is it?
2020.
Okay, and what are we doing today?
Just a checkup.
Okay, patient is A&O times 4. So what brings you in today?
Just a little bit of left knee pain.
Left knee pain?
Mm-hmm.
Okay, and is there anything that makes that pain better or worse?
Better when I'm sitting, and running makes it worse.
Running makes it worse, okay. And what would you say the quality of the pain is? Is it like a burning, aching, sharp pain?
Aching, sometimes sharp.
Sometimes sharp, aching, okay. Does the pain you have, does it radiate to anywhere else in your body?
The ankle at times.
The ankle at times, okay. And what would you say the severity of your pain is on a scale from 1 to 10, with 1 being the least amount of pain and 10 being the worst amount of pain possible?
About a 7.
A 7?
Yeah.
Okay. Can you tell me when this pain started?
2 weeks ago.
2 weeks ago?
Mm-hmm.
Okay. And does this pain you're having affect any of your daily activities?
Exercising. Yes.
Exercising? Okay. Well, I'm going to go ahead and assess your vital signs.
Okay.
So your blood pressure is 112/68, which is within defined limits. Your pulse is 56, which is slightly below defined limits. Your temperature is 37 degrees Celsius, which is within defined limits, and your respirations are 16, which is within defined limits.
Okay.
Now I'm going to start the head to toe portion of the assessment. Could you smile for me, please? Could you frown for me? Okay. Could you puff out your cheeks for me? Okay. Patient's face appears to be symmetric with any appearances of deformities, lesions, edema. Okay. And patient has an appropriate facial expression. Patient's eyelashes are symmetric and hair is distributed evenly and bilaterally. Okay. And now I'm going to go ahead and inspect your periorbital area and your eyelids.
Okay.
Now I'm going to go ahead and palpate your periorbital area. Are you experiencing any pain in this area?
No.
Okay. Now I'm going to go ahead and palpate your eyelids. So I'm going to pull down your eyelids first. When I pull down, I want you to look up for me, okay?
Right.
I'm going to go ahead and pull down. All right. Now I'm going to go ahead and pull up on your eyelids. When I pull up, I want you to look down for me.
Okay.
Okay. Patient's conjunctiva is pink and moist. Patient's sclera appears to be white. No ptosis, lid lag, discharge, or crusting of the eyelids. Eyelashes are curled up and are symmetric, and hair distributed evenly and bilaterally. Now I'm going to go ahead and use the top of my hand to palpate and feel for your temperature on your forehead. Okay. Patient's temperature appears to be warm. Okay. And now I'm going to go ahead and assess your pupils.
Okay.
So what I'm going to have you do is just focus in here on the bridge of my nose right here. And I'm just going to go ahead and go ahead and put my eye, or my pen light in each of your eyes, okay? So just go ahead and focus here on the bridge of my nose. Okay, so now I'm going to do the same exact thing, just keep staring here at the bridge of my nose, okay? Okay. Now I want you just to follow the tip of my pen, okay? And wherever it goes, just follow it, okay? Okay. Patient's pupils are equal, round, reactive to light and accommodation. Okay. Now I'm going to go ahead and inspect your ears. So go ahead and look here. And now I'm going to go ahead and palpate them and feel for any lumps, lesions, masses, crusting. Okay. Okay. Patient's ears are aligned properly and symmetric with no appearances of lesions, lumps, masses, crusting, or tenderness. Okay. And now I'm going to go ahead and inspect your oral mucosa. So if you could go ahead and just kind of look up with me with your mouth open and your tongue out wide and have your, there you go. Okay, so I'm going to go ahead and flash my light in there. Patient's oral mucosa appears to be pink and smooth. Tongue appears to be pink and rough. Teeth are white aligned occlusions. No signs of sores or lesions. And patient's gums and palate appear to be pink and smooth. Okay. Okay, so now I'm going to, actually, let me ask you, do you have any trouble swallowing?
No.
No trouble swallowing? Okay.
No.
I'm going to go ahead and palpate your neck area here around your trachea, okay? Okay, patient's trachea is in midline position. Now I'm going to go ahead and assess for skin turgor, okay? So basically what I'm going to just do is just pinch your skin here, kind of testing for your skin hydration. For your hydration, Jim. Okay. Patient's skin appears to be hydrated, with no signs of tinting, and so do you use any form of oxygen supplementation?
No.
Okay, and have you had a cough recently?
No.
Okay. Okay. Now I'm going to go ahead and do test your point localization. So I'm going to use this cotton ball here.
Okay.
I'm going to have you close your eyes, and I'm going to put this cotton ball in different parts of your body. And I want you to tell me where on your body I'm putting this cotton ball when your eyes are closed, okay? Wherever you can feel it.
Forehead. Cheek. Chin. Elbow. Finger. Hand. Arm. Finger. Elbow. Hand. Arm. Leg. Knee. Shin. Leg. Foot.
Okay. Patient experiences sensation bilaterally. Okay. Now I'm going to inspect and auscultate your interior lung sounds. Okay. So what I'm going to do, I'm going to place my stethoscope on points 1, 3, and 5 interiorly to listen to your lung sounds, and then I'm going to have, after that, I'm going to have you raise your right arm, and I'm going to listen to your right middle lobe of your right lung after, okay? So I'm just going to have you take a big deep breath for me whenever I place my stethoscope on your body, okay?
Okay.
Okay. Now, if you could raise your right arm for me, I'm going to go ahead and auscultate for your right middle lobe. Just when I place my stethoscope on your body, take a big deep breath for me, okay? Patient's chest expansion is symmetric and lung sounds are clear with no adventitious lung sounds. Now I'm going to listen to your heart sounds, listening at Herb's point for 15 seconds, okay? So if you could just relax for me, I'm going to go ahead and place my stethoscope on Herb's point. Okay. Patients S1 and S2 noted. Now I'm going to listen to auscultate your lung sounds posteriorly, okay, and check for expansion, symmetric expansion. Okay, so same thing except this time I'll be placing my stethoscope on points 2, 4, 6, and 9 posteriorly.
Right.
And if you could just take a deep breath whenever my stethoscope touches your body, okay?
Okay.
Deep breath for me. Now I'm going to put my hands on your back in like this, and I'm gonna have you take a big deep breath in for me and a big deep breath out, okay?
Alright.
So if you could turn this way for me a little bit. Big deep breath in, big deep breath out. Patient's chest expansion is symmetric posteriorly, and lung sounds posteriorly are clear with no signs of adventitious lung sounds. And so now if you could just relax your arms out like this for me, I'm going to inspect your upper and lower extremities. Okay, so patient's upper extremities appear to be symmetric. Skin color is appropriate with ethnicity. Hair is distributed evenly and bilaterally. Okay, and lower extremities appear to be symmetric. Hair is distributed evenly and bilaterally, and skin is appropriate with ethnicity. Okay, and now I'm going to excuse me, check cap refill on your fingers here. So if you could just put your fingers out for me, I'm going to check your upper extremity cap refill.
Okay.
Okay, so I'm going to just squeeze here. Patient's cap refill returns within 3 seconds. Nail beds are smooth with no signs of clubbing on the upper extremities. Okay, and now I'm going to palpate for your radial pulse. Okay, so if you just keep it there, you go. Patient's pulse is 2+ bilateral. Radial pulse is 2+ bilaterally. Now I'm going to check for the muscle strength of your upper extremities. So if you could just put your arms up like this for me. So I'm going to pull your arms towards me. When I pull them towards me, I want you to try to pull them back towards you, okay?
Okay.
Okay. Now I'm going to push your arms towards you. When I push them towards you, I want you to try and push them back towards me, okay? Patient's muscle strength is 5+ against resistance. Okay. Now I'm going to palpate your lower extremities for edema. Okay. Patient presents no edema in lower extremities. Okay. And now I'm going to palpate for your dorsalis pedis pulse. Patient's dorsalis pedis pulse is 2+ bilaterally. Now I'm going to palpate your tibialis posterior pulse. Okay. Posterior tibialis pulse. Patient's posterior tibialis pulse is 2+ bilaterally. Okay. Now I'm going to check the cap refill on your lower extremities. So I'm just going to squeeze it under your toes here and check for cap refill.
Okay.
Patient's cap refill returns within 3 seconds. No beds are smooth with no signs of clubbing. Okay. Now I'm going to check for the strength of your lower extremities. Okay. So if you just scoot up a little bit off. Okay. So now I'm going to pull your legs towards me. When I'm pulling towards me, I want you to try to bring them back towards you, okay?
Okay.
Okay. Now I'm going to push your legs towards you, and I want you to try to push them out towards me, okay?
Okay.
Okay. Patient's muscle strength is 5+ bilaterally. Okay. And now I'm going to inspect your abdomen. So if you could just lay back for me, please. Go ahead and cover it up here. Expose your abdomen, okay? So patient's abdomen, the skin on patient's abdomen is intact and smooth. No signs of lesions or disformities. No signs of distension. Umbilicus is midline and inverted. So let me ask you, when was your last bowel movement?
Probably about 2 hours ago.
2 hours ago. Okay, and what was the color of the bowel?
Brown.
Brown. Okay. And what would you say the amount was? Was it small, medium, large?
Medium.
A medium amount. Okay.
Yes.
And when was the last time you urinated?
About an hour ago.
About an hour ago. Okay. So what was the color of your urine?
It was clear yellow.
Clear yellow. Okay. And what was the amount? Would you say it was a small, medium amount? Okay. Okay. So now I'm gonna go ahead and perform a light palpation on your abdomen. You feeling any pain?
No.
Okay. Patient's abdomen is non-tender. No appearances of lumps or masses or distension. So now I'm going to go ahead and listen to your bowel sounds starting in the right lower quadrant. Okay. Patient's bowel sounds are normal and active. Now if you could sit up for me, please, and stand up here.
Okay.
And face that way. So now I'm going to inspect your bony prominences. So if you don't mind, I'm going to put your hair towards this way.
Okay.
So inspect your occiput, your your scapula, your coccyx, your sacrum, and your heels. Okay. Patient's skin is intact with no signs of breakdown. Okay. And then if you could just walk about 6 or 7 steps forward with me, going heel to toe.
Okay.
And then walk back once you get to the end there for me the same exact way. Patient shows the ability to walk with ease. Okay, and here's my sheet for vital signs, just to show that that's all I had on the sheet. Okay, that's good.